First Minister, we often hear commitments to achieve parity between mental and physical health. It's referenced in the new mental health and wellbeing strategy, but in practice, we are still seeing those significant disparities across the system. Waiting times for mental health support are often far longer than for physical treatments, and early intervention is also under-resourced, and many areas still lack accessible local mental health support. So what we need to hear from you is what concrete actions is the Welsh Government doing to specifically to ensure the parity of esteem between mental and physical health services. What we don't need to see is more shiny policy documents or more committees being set up to look at these things. What we need to see is actual delivery on the ground, helping people in their communities. Because I don't think that no one should have to wait to have their condition diagnosed or supported just because you cannot see it. And I'd like to hear what I said, concrete actions you are doing to address the disparity between the two issues. Yeah.
Well, thanks very much. Look, this is an area that we take very seriously. The fact that we published a refreshed, a new plan, a new strategy, that there's a delivery programme that runs alongside it, demonstrates how seriously we take this. The fact that we have a 1112 service in Wales that doesn't exist in other parts of the United Kingdom, of course, we've got a long way to go. But I really think it's important that people recognise that actually we have made some significant strides already in relation to mental health. So when you look at the figures, for the under 18s, 92% of them are seen within 28 days. And when it comes to from assessment to intervention, for over 18s, 92% of them have an actual intervention within 28 days. So this is massive progress compared to where we were. And I really think it's important that we underline that. There was a stage a few years ago where people had to wait for years to get the support. That is not the case anymore. Things have improved dramatically. We've always got more work to do, but I really think that we've started to shift the dial on this important matter that really affects a huge number of people in Wales.